In this video, we will discuss about this heterotypic CD8 plus T cells and the tumor cluster in the patient sample. In the previous video, we have discussed the in vitro result when we co-culture the T cells with the melanoma cancer cells. We are able to see a cluster of CD8 plus T cells and the melanoma tumor cells. And we have seen that when this clusters is injected into the mice, they are able to have the enhanced anti-tumor efficacy compared to the singlet T cells that are injected into the mice. In this video, we are able to we will see that the researchers had checked whether this kind of cluster of the CD8 plus T cells and the tumor or CD4 plus T cells and the tumors. Along with that, they also checked it for the APC and the tumor cells in the patient samples. So by they selected these APC and tumor samples that we will also discuss. So what they did is they took the 22 different patients who were affected with melanoma and took the melanoma cancers at different anatomical sites along with the lymph node. Since the lymph node is known to have the APC, so what they also checked it for the APC and tumor interactions in the lymph node. And when they check it for this tumor cells and the T cells cluster formations, they are able to see that T cells tumor cell clusters are formed. Along with that, the T cells APC clusters are also formed, indicating the activations of these T cells using APC. And this and these results, they have seen it for all the 22 patients that they have checked. The combined results are shown in this panel C. Thereafter, they checked it in the immunofluorescence, they checked it in the microscopic image, the whether this cluster formations is actually occurred or it is to check to confirm these cluster formations. After getting the positive results from the flow cytometry, they also checked it the immunofluorescence images in the microscope. And here the first 3 rows are for the singlet, and thereafter the second 2 rows are for this tumor and T cell clusters, where we can see that the T cells and tumor clusters are formed. And then they also check it for APC and T cell clusters. They are also formed, and mainly this could be in the lymph node. And then they also found out that there is a combination of all the threes are also there, that is tumors, T cells and APC, that can be seen in these 2 rows. And this indicates that the combined interactions of these immune systems against the tumors. And thereafter they also check it for the markers that are known to enhance the cell-cell interactions, such as this HLA-ABC, CD58, and they are able to see that these markers are aligned themselves in the cell-cell interaction positions that can be seen here. So this again indicates that the role of these markers such as this HLA-ABC, CD58 are also playing a role in this immune cells and tumor cells interactions. So this panel D and panel E are the results for the CD8 plus T cells. They also check the results for CD4 plus T cell clusters, and here they are also able to see CD4 plus T cell clusters that can be seen here, the APC tumors interactions, and here the T cells tumor interactions, and here the CD4 and CD8 plus T both cells are interacting. So this indicates that the CD8 plus cells, CD4 plus cells, both of them takes role towards the suppression of the tumors in the patients. Thereafter, they finally they checked the patient's samples with different immunofluorescence marker, and they are able to see that the APCs, CD8 plus T cells, APCs, CD8 plus T cells, and also these tumor cells which are lie in the vicinities or within 10 micrometers, they are able to show a similar kind of functions. That is, there is high chance of cluster formations in that case. that is being seen from this this multiple markers of the immunofluorescence images. Some of the markers are shown here, where they checked it for the SOX, APC, and this T cells, and then P2 and this P6. So all this indicates that the T cells, CD8 plus T cells, tumor cells, APCs which are in the vicinity shows common niche or similar functions of making a clusters. So that's all for this video. I hope you understood how they validate their in vitro studies, whether they exist in the that phenomena exists in the in vivo studies or not. For that they use 22 different melanoma patient cancer samples data. That's all for this video. If you need to understand more about this experiments or these results in detail, you can go through the reference that has been provided in the description. That's all for this video. Thank you for your time.